Up next, we have Patrick McNally from the Wellbeing Index, our presenting sponsor of the Champions of Wellness Virtual Summit 2021. Patrick McNally is the Sales Operations Director of the Wellbeing Index and has partnered with hundreds of hospital systems, associations, academical medical centers, and more to help create buy-in for leadership teams to utilize the Wellbeing Index as a must-have tool for determining stress levels and providing resources for clinicians. Patrick's expertise in healthcare employee well-being and wellness program implementation has provided teams with the data and resources needed to go beyond burnout. Today, he will be sharing well-being insights from over 20,000 physicians surveyed in 2020 and 2021. So please join me in welcoming to the Virtual Summit stage, Patrick McNally.
Thank you so much, everyone. I greatly appreciate you having us and allowing us to be a part of such a great virtual summit. We heard from some great speakers yesterday, and I'm excited to share some insights with you today. So today I will be talking about a shock to the system, well-being insights from 20,000 physicians surveyed in the past year and a half. I'm excited to join you all and discuss this very important topic. My name is Patrick McNally. I'm the Director of Sales Operations for the Wellbeing Index. And in that role, I'm charged with ensuring that leaders understand the impact that access to wellbeing data can have on their employees and their organizations. I'm privileged to speak with healthcare leaders and wellbeing champions such as yourselves every day as they embark on a journey to create well-being programs and implement strategies to foster a workplace culture of wellness. The Wellbeing Index is honored to support and participate in the Champions of Wellness initiatives such as this summit, and we appreciate the opportunity to present today. For those of you that might not be familiar with the Wellbeing Index, it is a validated 7 or 9 question assessment invented at Mayo Clinic by Dr. Lottie Derby and Dr. Tate Shanafelt. Unlike some assessments, the Wellbeing Index goes beyond burnout to measure multiple dimensions of distress and well-being. The Wellbeing Index is used by individuals and organizations to measure distress and help improve the well-being of their employees. Since its development, we've gathered data from over 365,000 assessments. So you may be wondering, where do these individuals come from? Here are a list of just some of our partners. This is by no means all of them. There are over 800 institutions worldwide using the Wellbeing Index. I've been personally involved in helping over 50 healthcare organizations from around the world get started with and successfully implement the tool, both before and during the COVID-19 pandemic. Our work has helped individuals gain insights into their baseline levels of well-being, the ability to track changes over time, and have access to resources to help support and improve their overall well-being. We provide leadership teams with data to better understand clinician distress in their organizations and strategic resources to help maximize physician well-being. The focus of today's presentation will be threefold. First, we will report on insights from Physician Wellbeing Index assessments gathered in 2020, some of which were quite surprising. Second, we will review strategies some of our partner organizations have found success with in using their data to improve physician wellness. Finally, we'll look at data from the first part of 2021 to understand where physician well-being may be headed in the near future. So let's get started. As we begin our look at this data, let us remember when these assessments were collected. As we all know, 2020 was a year unlike any other. We experienced a global health pandemic, the likes of which we have not seen in over a century. This impacted the very fabric of our daily lives. Many of us lost friends or loved ones, endured economic hardships, and had drastic changes in social interaction, and the way we work was affected at some level for almost all of us. Medical professionals that we work with every day faced unique and unimaginable circumstances at work and at home, on top of the existing levels of burnout already far above the average for most professions. Our health systems saw drastic changes in operation, shuttering elective and non critical care procedures, furloughs and the associated financial impacts, massive shifts in workload, all added to the stressful situations of confronting a brand new virus. How exactly did these changes affect physician well being? Hundreds of hospitals, institutions, health systems, and medical centers turned to the Well-Being Index to find out. With tens of thousands of physicians assessing and reassessing their well-being throughout the year. From January 1st through December 31st, 2020, over 28,000 physicians worldwide assessed their well-being using the Well-Being Index. These physicians were employed at a variety of different types of healthcare organizations: standalone hospitals, private clinics, academic medical centers, nationwide health systems, and professional associations. They all had a variety of different challenges. These physicians were also located around the world. The Well-Being Index licensed by organizations in the United States, Africa, Australia, Canada, New Zealand, and the United Kingdom. So you're probably wondering, what did we find? We found that over 36% of physicians that assessed during 2020 experienced what we term a high level of distress. As you can see, this has some alarming implications for the health and well-being of these individuals. Individuals with scores that meet or exceed the high level of distress threshold in the Well-Being Index are an increased risk for a number of severe outcomes, such as burnout, severe fatigue, suicidal ideation, and other dimensions of distress. The high level of distress threshold has been validated and determined by Dr. Lottie Derby and Dr. Tate Shanafelt during the initial validation process, and it varies by occupation as each version of the Well-Being Index was validated separately. In this specific case, we're looking at the risk factors for physicians experiencing a high level of distress. In addition to the high level of distress reporting, we also found concerning data from the assessment responses. Over 51% of physicians reported feeling burned out from their work, and over 53% reported emotional problems, such as feeling anxious, depressed, or irritable. Along with experiencing burnout and emotional problems, 30% reported that their work schedules did not leave them enough time for their personal or family lives. This is extremely important because satisfaction with work-life balance is correlated with lower levels of burnout in several studies conducted over the course of 6 years by Dr. Derby, Dr. Shanafelt, and other colleagues. Along with being a measurement tool, the Well-Being Index provides participants with national resources to help them improve well-being, and partner organizations can add customized local resources specific to their region and their organization. Throughout 2020, physicians who assessed also most commonly access resources in several key categories. While the categories you see here were the most accessed in 2020, Other categories include health behavior, organization and leadership resources, money, alcohol or substance abuse, and medical error and malpractice. While all categories saw an increase in views from 2019 to 2020, emotional concerns took a noticeable jump when looking at data with our partners, increasing by nearly 50% year over year. Although these data points are alarming and shed some light on the epidemic of physician distress, we noticed something rather surprising when looking at the high level of distress data from 2019 to 2020. The percentage of physicians that met or exceeded the high level of distress threshold actually decreased from the previous year. With the circumstances of 2020 in mind, we thought distress would be off the charts. But overall, this is not what the data showed. We knew we had to take a closer look at the data to find an explanation. And this search led to the creation of our COVID-19 impact report. In an effort to provide additional context to the assessment data gathered in 2020, we sent out an additional COVID-19 impact survey with a variety of follow-up questions to individuals who had assessed their well-being during the period of March through August 2020. Over 4,300 individuals in the United States submitted anonymous and voluntary responses across all healthcare professions, including physicians, residents, nurses, advanced practice providers, medical students, pharmacists, and other healthcare employees. And here is what they told us. Among the insights gathered from the COVID impact survey, we learned that 39% of all physicians who responded were financially impacted due to the pandemic, with over 71% taking a pay reduction. This was the highest percentage of all healthcare workers who submitted survey responses. However, responding physicians reported the least impact regarding furloughs or forced time off. Nurses, on the other hand, experienced furloughs at over 30% and forced time off at over 40%. While physicians were the most financially impacted group among healthcare professionals that we surveyed as part of our COVID impact report, their distress levels were lower than other occupations and even lower than previous years, reflecting what we saw in the larger global data set, including 2020 assessment data. As you can see here, over 35% of physicians surveyed met the high level of distress threshold, which is far lower than the nearly 54% of nurses and 47% of general healthcare employees that experienced high levels of distress, both groups showing increases from the year prior. As we talked with physician leaders, coaches, and psychologists, we heard one possible explanation for why fewer physicians may be experiencing high levels of distress than expected during a global pandemic. That despite the influx of patients and difficult situations institutions faced during the pandemic, many physicians were able to practice with fewer barriers and less red tape than ever before, increased feelings of value and sense of meaning in their work, and they were able to reconnect with their purpose and passion for patient care and the reason they entered the field in the first place. In fact, insights from our survey seem to back up this theory. We found that among physicians directly involved in patient care, the percent experiencing a high level of distress was lower than most other occupations throughout the same time frame, a possible reflection of the increase in connection and meaning to their work. The percent of physicians at a high level of distress also slightly decreased as time went on, as opposed to other occupations that saw an increasing percentage at a high level of distress, Coinciding with the increased understanding of COVID-19, how to treat infected patients, and ways to better protect themselves, their colleagues, and their families. So you may be wondering, what does all this mean? All the data in the world doesn't do any good unless we can use it to guide our efforts to improve well-being. As we continue to emerge from the COVID-19 pandemic, more and more healthcare leaders and institutions are understanding the importance of clinician well-being and investing resources to identify what is working well and what may need some further improvement. While the pandemic has opened many eyes to the need for impactful resources, accurate well-being measurement, hundreds of organizations had already been using this data to drive their well-being programs and support their staff prior to the pandemic. We can learn from the specific examples of how a few of our partner organizations are leveraging the type of assessment data we've been examining thus far to direct and assist their wellness program, and hopefully provide you some insights to help accelerate your own well-being efforts. Our first example of how institutions can use assessment data to improve well-being is from CommonSpirit Health. In February of 2019, CommonSpirit Health was born from the merger of Catholic Health Initiatives and Dignity Health, the largest Catholic health system and second largest nonprofit hospital chain in the United States. 8 months after CommonSpirit's formation, they created a wellness committee led by Dr. Keith Frey, Chief Medical Officer of the Arizona Division. Dr. Frey knew they needed to utilize the latest resources and evidence-based tactics to make a real difference and effectively protect the mental health of the thousands of their providers. To begin their journey, they focused on developing a new organizational culture dedicated to well-being and decided they would implement the Well-Being Index to help guide their efforts. Specifically, Dr. Frey and his team utilized these strategies to support their efforts. First and foremost, segmented reporting. With an organization as large as CommonSpirit Health, it's a daunting task to accurately gauge the state of well-being among tens of thousands of providers across various regions, states, and locations. We worked with CommonSpirit to have each delivery site demographically labeled to be able to segment the data and easily determine where the hot spots were and where to focus their support first. Second, we armed physician leaders with data. Dr. Frey and his team couldn't personally reach out to thousands of physicians. They instead focused on educating physician leaders and champions of wellness, such as yourself, within the organization to amplify the message of wellness in their local regions. These leaders use data from the Wellbeing Index to help guide conversations with their local leadership teams. This information, coupled with direct feedback from their providers, helped increase buy-in and improve communications with their staff. Finally, they had access to resource access reporting. As we saw with the 2020 physician assessment data, resource access reporting can be a valuable tool to gain insight into areas where providers are searching for help, which is exactly what the team at CommonSpirit is doing. They can see what categories specific populations are searching for, allowing them to better direct proper resources where they are needed most, increasing the impact of the well-being program and the efficiency for which they're providing those resources. As we can see with the CommonSpirit Health, the largest organizations are finding successful strategies using assessment data to guide wellness tactics. But these techniques are also being utilized by smaller regional and standalone hospitals and every organization in between. This next example focuses on ways a regional health group is using their data to improve provider well-being. They were asked to be kept anonymous to protect confidentiality. To guide their efforts, leadership established a set of core wellness goals, including number one, developing and delivering individual wellness resources. Number two, improving internal processes to maximize staff fulfillment. And number three, suicide prevention. To reach these goals and measure their progress, this health group implemented the Wellbeing Index. As a smaller group, they use the tool quite differently than a much larger national health system, such as we just saw. Everything from the communication process to the types of demographic and feedback questions were customized to fit their needs. They had to implement and create a desire for change. One initial tactic was to simply show providers and key stakeholders at the ground level that there is a problem with distress and burnout at their organization to receive the buy-in needed to invest additional resources. Next, this organization used the Wellbeing Index tracking capabilities to encourage participants to consistently measure their well-being and track the assessment progress over time, developing the awareness that this is a key component of creating a culture of wellness. In terms of how they went about preventing suicide, after initial assessment period, leadership discovered through aggregate reporting that there were individuals in the organization at an increased and high risk for suicidal ideation. As one of the core goals was suicide prevention, wellness leaders were able to use the data from the Wellbeing Index to identify and launch specific resources needed, including physician forums and discussion on suicide prevention, and measures to remove stigma and normalize the conversation around mental health. Finally, in improving the system, these leaders also understood that internal processes and culture play a large role in staff well-being and mental health. To reach their goal of identifying and correcting systemic factors that have historically led to less than optimal well-being, they turned to the feedback collected through the Wellbeing Index process improvement questions. Using the tools provided by the Wellbeing Index, they were able to identify common threads and roadblocks reported by their clinicians. This led to an implementation and updated code of conduct, enhanced two-way communication throughout the organization, updating their onboarding policy, and providing additional leadership training focused on their areas of concern. CommonSpirit and our other partners are doing great work to understand the levels of distress within their organizations, digging deeper into the causes of that distress and taking action to address those causes and improve well-being. As we've worked with our partners over the years to identify needs and improve well-being, we've identified a new goal: become more proactive in our efforts around physician well-being. As we approach the end of 2020, we can look at the data to get an idea of where well-being is headed in the near future and try to anticipate where the needs will be greatest. But to start, let's take a look back. Understanding where we've been is critical to understanding where we're headed. As you can see, previous year's data on physicians at a high level of distress show a decrease over time, which is a very good trend, but it's at a fairly slow and steady rate, only 1% to 2% change per year. As we saw previously, 2020 showed a sharp decrease in distress, about 11% change year over year. It's important to remember the possible factors associated with this decrease. Fewer barriers than before, increased feelings of value and meaning in their work, reconnecting with their purpose and passion for patient care. As we've begun to analyze the assessment data from the beginning of the year until August, we're seeing a roughly 5% increase in high level distress compared to the same period last year. Speaking again with physician leaders, coaches, and psychologists has provided some insight into why this may be. As we begin to return to a closer approximation of pre-pandemic life, some of the stressors that were reduced during the pandemic are starting to creep back in, and new issues are arising. Physicians are no longer in flight or fight stress response. This means they're starting to feel the impact of the last 16 to 18 months, and we are hearing and seeing reports of PTSD-like symptoms becoming more prevalent among providers. Many organizations are also experiencing the loss of providers, including nurses, administrative staff through early retirements, and individuals changing professions altogether, thus increasing pressure where in many cases staffing has already been a challenge. These effects are being felt across organizations, impacting the entire care team. Now, I know this sounds very depressing, but there is hope. Organizations have learned many lessons during the pandemic that can benefit providers and patients. Increased use and comfort with telehealth systems, which studies show can reduce the effect of patient surge on facilities. It addresses limitations to healthcare access, and it conserves PPE. Increase in transparency and quality of communications between the organization and their providers. It's one of the 5 key requests from providers to their organizations identified by Dr. Shanafelt and colleagues in an article published in April 2020. And finally, prioritization of well-being efforts. The COVID-19 pandemic brought with it many challenges and highlighted the need for organizations to work with their providers to develop a culture of well-being that actively supports, both in time and resources, individual wellness. And one final thought: measurement will be vital for organizations to create systems and environments that protect our providers so that they can continue to provide excellent patient care. As further research is done on clinician distress and organizations continue to prioritize physician wellness, like the examples that we've just seen, our hope is that as a healthcare community, we can gain a more complete understanding of the various dimensions of distress and aim to make medicine as safe and fulfilling as we know it can be. I want to thank you again for allowing me to give this presentation and for attending this Champions of Wellness Virtual Summit. You can go online to mywellbeingindex.org to access the full Wellbeing Index Insights reports, including the State of Wellbeing 2020 and the COVID-19 Impact Report that we mentioned. You can also view the case studies detailing and outlining how these partner organizations are utilizing Wellbeing Index assessment data and successful strategies they are finding to improve physician wellness. Thank you again for attending, and I'm happy to open it up to a few questions.